Welcome to the next installment of the Many Minds podcast, where we encourage collaborative community healthcare using many minds for better outcomes. I am your host, Alex Davis, physician assistant, along with
Tyler Murray, nurse practitioner.
And the two of us work together at Summit Brain, Spine, and Orthopedics in Lehi, Utah. The purpose of this podcast is to promote interaction between specialties and dig into what makes your specialty special. I want to talk about the stuff we don't usually get to talk about as healthcare providers. What is life like in your shoes, and how can we support what you're doing to provide better care for our patients?
General disclaimer, the podcast represents the opinions of myself, Alex, and our guest on the show. The content from the podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. We're just here to learn and have fun. With that, let's jump into the podcast. We have Morgan Unga with us. He actually works at Summit here with us, but he's in our orthopedic specialty. Mm-hmm. Welcome to the show, Morgan. I want you to first and foremost just kick it out. Tell us who you are, kind of your background, and kind of how you ended up in orthopedics.
Yeah, so my name is Morgan Unga. I am from Ogden, Utah. I did my undergrad at BYU in exercise science. That's actually where I met Alex. Played some sports there, got to know him in that setting. And then I followed Alex to Rocky Mountain University for their PA program. So he had just finished, and then I started. And then Alex came here, so I figured I'd come here
One more time. Yeah. Let's keep it going.
So then, but I always knew I wanted to do orthopedics. My wife's from California. We thought we'd live in California after school. Went and did probably 7 months of my rotations out there. Just realized probably wasn't for us. And so came back looking here and met Dr. Pitts, and it all worked out. So
did you always know you wanted to be a PA? Is that something?
No. So I had always thought in undergrad, in high school, I thought med school. In undergrad, I started thinking probably not going to be doing med school. Don't know that I could have done that much school.
Yeah.
And was interested in like physical, being like a sports trainer or a physical therapist or athletic trainer, right? That was kind of interesting to me. And I felt like PA was a sweet spot in between where you could still be in the clinic, and orthopedics is fun because you get to deal with functionality of the body. And so orthopedic PA was kind of the dream.
That's awesome. Yeah, I was in sports medicine as well. That's kind of what he was alluding to, where we met down there at BYU. And I always enjoyed helping people that were hurt, not just people that were sick.
Right.
And I think that's kind of the underlying tone in orthopedics, is you get to help people that are in a bad spot. Maybe they're healthy people, but they got hurt. They need some help.
And fun to watch them return to play, right? Like,
oh, yeah.
Someone that has had like a pretty serious injury the next year or even months later, like seeing them succeed again is fulfilling.
Yeah. It's like the ultimate team goal is working together and having success by watching somebody else's success, knowing that you were able to help along that path. It's gratifying. It's fun work to be involved in.
Yeah. Your name actually got thrown out earlier this week by Jake, one of the striker reps.
Oh,
and he was talking to all of his buddies, and they had said you had bailed him out a number of times, just with like injuries that all had. But there was apparently an incident where everyone ate at the same restaurant and everyone got sick.
Oh my gosh, yeah.
And
it was an international trip. We went to Curacao down in the Caribbean. So we are far from home.
Yeah.
You have limited resources of what you can just pack in your little bag with you. And it's not like you can just run down to the pharmacy down the street, because it's just not set up that way in that country. Right. And a lot of people were not accustomed to the cuisine down there, and it hit everybody all at once. The entire team, our whole travel party of 40-something people, all in one night, coming out of both ends. The things that I saw in the room, I was just making laps around the hotel in every room, passing out anything I could to try and stop the massacre that was happening in our hotel.
They said you saved everybody. They were like, he was our superhero. That weekend, because they were all struggling.
Yeah. Real quick, I saw one of our biggest players. He had to have been, I can't remember how big he was, 6'6", and he's probably 240. Big kid on the team. And I come into his room, and he is in the fetal position, butt naked on the floor in the bathroom. I was like, dude, what are you doing? What is happening? And he's like, I was on the toilet and I was struggling, and then I had to throw up and I didn't know what to do. So I just went to the bathtub, and now I'm just somewhere in between. I don't know which way it's going.
Oh my goodness.
So that's,
Where was this trip?
Curacao. Yeah, we went down to play.
Where is that?
Some of the baseball teams. It's right off the coast of Venezuela. It's way down just off of South America.
Oh.
down the bottom end of the Caribbean.
Nothing
Anyway,
that will humble you more.
Oh yeah.
Viral or bacterial
Oh,
infection.
oh yeah.
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 Both
Fun
ends.
stuff.
That's a problem.
Fun stuff. Fun
I
stuff.
love that. I love that. All right, well, let's jump into it.
'Kay.
Morgan, I want you to kind of talk to us about what your day-to-day or week-to-week kind of looks like from a PA's lens in an orthopedic setting. What are you doing as far as your workload management goes?
Yeah. So working with Dr. Pitts. Dr. Pitts is a joint replacement specialist, but he's also an orthopedic surgeon, right? And so he's doing all the fractures. He's essentially done like a fellowship in hand as well. So he gets a ton of hand cases. And so I'd say probably 60% of our cases are joint replacements, another 20 of just trauma, broken arms, and then the other 20, just a mix of different hand things, whether it's finger fractures, pinnings, ganglion cysts. Every once in a while we're doing some tendon repair in the hand. So yeah, a fun mix.
A fun mix.
Yeah.
What's your clinic to surgery ratio right now? How much are you in the clinic? How much are you assisting in the OR?
Yeah, I'd say it's probably 2 days of just clinic, 2 days of just OR, and then the 5th day is like a split. So we're doing some cases before clinic.
Let's let the listeners know, though, because you have a different setup than Alex and I. How many patients in the clinic are you seeing in a single day?
For some comparison, you and I are 16, 17 patients a day that we see on a full clinic day.
We're sweating. We're ready to go home.
Yeah.
We'll see. I think the busiest day Dr. Pitts and I had was like 59. And then, but we're pretty typically at like, and I say 59 is we split that, right?
Sure,
so we kind of just, where it's back and forth. Yeah. And then typically we're to about 50. So we're seeing about 25 a piece.
That's busy. Yeah.
Which you have to crank. And some of them are post-ops that are really quick, but others are, my shoulder hurts and my knee hurts and my neck hurts from an accident 20 years ago. And so those take some time.
Yeah, but the bane of existence for all of healthcare, it's great to see that many people. I'm sure it's fun. I have a good time interacting with that many people, helping them with their problems. And in the end of the day, now you've got 59 notes to write and sit at a computer. That's got to be awful.
Yeah. Documentation is my biggest pet peeve.
Yeah.
I had actually heard, I don't know if this is actually happening, but someone had talked about an AI where they had it recorded in the room and it was able to break down the note.
Sure. Yeah. I'm sure that's
so you
the
just
next
did the
wave of things.
visit and then you saw the note after, and it like it pretty much was able to go through and sift.
And that would be
good
great
H&P.
if it could keep within line the personal touch. You know what I mean? Like when you put an assessment and plan.
Right, for sure.
You really, but if it's taking your words and being able to organize that, boy, that would be profound.
Which Dr. Pitts was just showing me today. So he's working on his summit conference presentations.
Yeah.
And he was showing how he was using AI to create things.
Format.
Yeah. And so
It's not a bad idea.
this isn't going to come out before summit conference, is it?
No way.
So he was like, well, we're talking about longevity. And so he literally was like, show me the fountain of youth using only orthopedic joint replacement parts.
Oh my gosh.
And it creates these pictures, and it was nuts. It's literally like this fountain of knees and femurs and tibias and arms and shoulders and all the replacement parts like spraying out of the top.
Oh my
I'm
gosh.
like, that's nuts. So AI, I'm sure we're not too far off from
Hopefully we're not going to be replaced
Can't wait.
anytime soon. But
yeah, we might be replaced by the time this podcast comes out.
That's awesome. What do you like as with that kind of a schedule mix? Do you like those clinic days? Do you like the OR days? What's your preference?
Yeah, I like clinic just because I feel like it's boom, 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 right? I feel like you're in control. You can kind of crank things out, see a lot of people, help a lot of people. Fun to do injections, all of that. See how patients are improving for the post-op patients. That's really fulfilling. That's the part where it's like, I couldn't walk 3 months ago. Now I'm here and I was able to just walk a 5K or jog a 5K with family members. It's like, that's cool to see. Clinic, I mean, the OR is fun just because it's blood and guts.
Hands on. You get to get your
and you got to experience
hands dirty.
Like,
I did.
Joint replacement surgery is different than neurosurgery, and we've kind of compared because I've actually gotten to go with Dr. Edwards.
It's true. Yeah, we've swapped places
and see the fine touch that's there, but also you see in like a knee replacement, we tell patients that's literally like construction. So you're hammering in implants, and people think like, oh, it's like you're tapping in there. No, you're like, you're cocking back and letting it go, trying to hammer something into the bone.
I'll never forget that video that Dr. Pitts showed us in his rounds discussion. I think it was Dr. Pitts showed us of removing the IM nail. Oh my
God, going at it.
Like breaking two people holding it and the other person
workout.
Like full golf swing whacking it.
Getting after it. Orthopedics love their mallets.
Yeah.
Yeah. That's awesome.
In contrast, we were talking about this before, with your guys' surgeries, it's such a small hole in the back.
Yes.
And it's so, I mean, there's not a higher risk surgery than brain and spinal cord.
Yeah.
Right? Like higher risk for anything going wrong. And you guys have this tiny little hole, and you're looking through this little microscope, right? And Dr. Edwards on one side, you're on the other side. Yeah. And so I thought, like,
we have classical music playing, and
you guys are, you guys are dialed in.
We're elevated.
Yeah.
And the one time I went to help, I remember, I mean, I think I just had suction was probably all I had in there, and he's kind of getting around the disc, and he's cleaning it up, and he's trying to make sure that everything's proper, and there's this tiny little hole, and he's got two instruments in there, and I've got one, and instead of just holding it still, I'm like bouncing all over the place.
Yeah.
And he has to keep like stopping me and just be like, oh, right here, no, just keep it still. And so I gained a lot of respect for the fine motor skill that you guys have. I'm just whacking things with a hammer. So.
Yeah. Hearing you talk about the orthopedic cases, though, did remind me of, I was an orderly back in the day for one of the hospitals around here, and they did a lot of joint replacements, and we'd go in and turn over the rooms for them. And I had this gentleman I worked with, he's from Brazil, and anytime we would see, the shavings or the tissue from the removal of the joint, we'd be sweeping up the floor, and he'd look down at me and look at me, and he'd say, "Hey, Tyler, carnitas for the tacos." And I would always be like, what? I'm like, but it just tells you, like, it's messy. It's
that was the last time you ate carnitas.
Right? I was like, ugh, no. It actually didn't bother me. You kind of become
numb to that a little bit.
Oh my gosh. Yeah. And with their replacement cases, you wear the full-on hood, and the shield over your face splattered. And I watch, just like in an instant, Dr. Pitts grabs the little tab and pulls it off, and he's got a clear face shield. And I had no idea they even did that.
I would have been struggling, like,
that's
am
amazing.
I supposed to like do anything about this? Or
but
what?
it gets messy enough. You need to have multiple face shields.
So you peel it off as you go.
Gosh.
Yeah, pretty wild.
What people don't know. That's crazy.
Yeah, it's a bloodbath in there.
It looked like a crime scene every time I came in and cleaned something out.
Well, and there's times when people were cleaning, and like you'll clean the bed, you mop the ground, you're wiping everything, and people don't realize, like, you have to clean the lights.
Yes.
Oh,
because there is blood splattering on the lights. Yeah.
That's crazy.
So it's
to counter that, though, it's actually very precise. That was the other thing that I took away from that, was using the robot and the navigation system. That is incredibly precise at the same time. It sounds a little bit barbaric just by the nature of having to mallet in these implants and things like that, but the precision is impressive.
Crazy, right? And so that's the robot. So people hear the robot, and they're like, as you've mentioned before, they're thinking like C-3POs in the room, like beep, boom, beep, boom, kind of back like that. But so it's just a software and a hardware. The hardware is just the box that you saw, right? And just a single arm. With
it looks like these microphones. It's just coming off. And
just
you control the tip of it. Yeah,
it's got a sterile cover on it, and then Dr. Pitts can just control the single arm to make those cuts. And the precision comes as the saw won't turn on unless it's in the exact right plane to make the cuts. So if we ever get like twisted or turned a little too much, it won't turn on. And it will, once you get in the right spot, it'll lock, and you can only cut in that plane. And that's where the precision comes from.
And this is a collective team approach. I mean, there's a lot of planning that goes involved with these joint replacements, right? You're taking imaging, using the medical reps, the system, obviously Dr. Pitts, and you're kind of planning it out. So there's a lot that goes into a joint replacement. But
for sure.
I think what it proves is, again, the precision makes a difference. He always said like 1 or 2 millimeters can make a difference.
Oh, a ton. And there are some patients that we'll see, and they will have been denied previously. I think most surgeons aren't shying away from those kind of surgeries anymore, but they will have been denied before, like, that's a dysplastic hip, like I'm not going to mess around with that. And now with the surgical planning, there are some patients that have needed it for a while. We can go in and say, we know exactly where this needs to be, right? And even for the really tricky cases, like, we can just confirm with the rep, and the Mako rep being the robot itself, right? That rep feels really confident where it's going. And what would take, 30 to 40 minutes of confirming placement, like in one of the cases we had a couple weeks ago, that one of the patients that had been denied before, we did their cup implant in, not kidding, like 3 minutes.
Wow.
Like we just confirmed,
impressive.
Reamed, hammered in the implant, and it was fast. It was that's kind of the confidence that comes from a robot.
Love that.
That's awesome. Tell us about your life outside the office. The thing that we're interested in is just getting to know your specialty. So,
Yeah.
I mean, how do you balance this of being one-on-one with a surgeon, all of your clinic time, all of your OR time, on call and trauma cases that you take on? I mean, what's your balance like?
Yeah, so Dr. Pitts is awesome. He's been so good about being like, hey, like you've got a young family, you've got to balance this. So however you can, I'm willing to be flexible with you. But like when you're here, hustle, let's get things done. Let's be more efficient, especially in a growing practice, right? There's a lot of, and this is something we've talked about before as well. Like you guys have dialed in your practice to where it's like every movement is precise, and you guys are like the epitome of being efficient through stuff, right?
Yeah.
And I feel like in a new practice, it's getting everyone trained to know, right? That team, it's the rep for the robot, it's the OR team, right? Being able to actually have a really efficient case every single time. And so there's been growing pains, but we're starting to get into a rhythm for sure, right? That we can knock out more cases in the time that before would take us. That's
always a fear, though. At least I had. I knew that going into the work setting is if you get into a surgical practice, the stereotype is that you're giving up your life because of the scheduling and the time commitments and things like that. Have you felt that? Is that a burden on you?
A bit, but again, Dr. Pitts has always just been really cool about like understanding. He gives me some afternoons off after we've had like some longer days, and we've kind of worked that into the schedule now.
Yeah.
And so knowing that, like, I mean, I think last week there were something had to be done before clinic or OR every morning. So it was like every morning it was either like waking up to drive to one hospital, discharge some patients before we had cases at another hospital. That happened a couple times. Waking up early to discharge patients before a clinic day, right? So he kind of takes all that into account and is super cool about all of it.
That's awesome.
Well, I think there's a lot of investment when a surgeon or physician decides to take on an advanced practitioner.
Right.
I think they have to realize, or we even have to realize, that there has to be some level of understanding. Like they're going to put in a lot of effort, money. You think about the education, the time it takes to train an advanced practitioner to do what they need to do to help a practice. So I think for the other advanced practitioners that are listening there, you need to make sure you're giving that feedback, though, because if you don't tell the physician you're feeling like you're burning out, you're going to burn out, and it's going to be a lose-lose situation. Yeah, because it's hard to...
And it's a lose-lose for everyone.
It really is.
Yeah.
Yeah, and I think that's just an important thing to remember, is to have that good relationship with, whoever you're working with, and make sure you feel like there's a balance with the work-life ratio.
And we've all seen that too, right? Like there's plenty of surgeons or doctors who go through a mid-level every 2 years, right? And it's like just when they hit their stride, they're gone. Just because the balance of having to have a family and whatever else they had going on, like you just can't do it because there's only so many.
Or they're enticed by another opportunity.
Yeah,
so there's always this...
Where there is more of a balance.
Yes.
For sure.
Yeah. I think that's an important thing to remember, for sure.
Do you guys have anything outside of the office that you're involved in? Because we get to do a lot of different things. I mean, whether it be something fun together or another side venture or whatever project it may be that kind of keeps you entertained as well.
Yeah.
And I feel like Orthopedics has that as well. You guys can be involved in the community in a lot of ways.
Yeah. Well, and the thing we've talked about before as well, we've talked about a lot of it. Talked about a lot of things before.
Yeah.
Like you were doing for BYU 2 years ago, right? You're involved with that. I would have loved to get involved with a team, but I haven't done anything like that.
Yeah.
I mean, other than like Summit, huge shout out to Summit and Amelia for always putting cool things together. It's like there's always something fun going on with Summit, right? Like we just had the Summit Olympics, and we've got the Summit Conference coming up, which is awesome. Get to learn a ton there. So there's always in this, I feel like this is always something cool outside of the OR and outside of the clinic, where you get to grow in another way as a clinician and as a person.
Yeah.
That stuff is cool.
Yeah, it's fun. I like doing this kind of stuff because we get to meet people, get to know people, and build the relationships. That's kind of my favorite part, is getting to interact with everybody.
Oh, yeah.
And everybody needs a good orthopedist. on,
for sure.
on speed dial. So I'm sure you guys get hit up all the time and get to interact and meet the community.
Everyone's got back pain. So you guys probably get just contacted by all the family members and the in-laws about back pain and headaches and more than you'd like. Tyler's like, everyone has back pain. I can tell you.
Yeah, we were talking about it recently. I don't want to interrupt you, but it seems anymore like every patient that we see or every other patient that we see like is somebody or knows somebody that knows somebody. It's all these personal interactions. That's kind of where it's going these days is people know each other.
It's all of my wife's family members.
I was just going to say.
I think I've set the standard with my family. I'm like, I'm happy to talk with you, but there's a limit of what I'm going to do. But and it's been good. I think it's...
Can't say no to the in-laws.
You can't. You can't burn any bridges there.
Yeah.
So, no. But it's been good to be able to be a support system. And a lot of times it's been like, hey, I'm probably not the right guy, but let's have you go see Morgan because this looks like an orthopedics problem. And that's what's been so nice about Summit is just the how we're all interconnected and having relationships that we do. And I think you guys kind of do your own thing, even though we're all Summit. I know you guys are building your own practice and doing a great job at it. And we're trying to keep up with Dr. Edwards. And it's been a great thing, though. So it's been super satisfying. And I love the role of the advanced practitioner in that we get to make a difference. I mean, you make a difference in clinic, you make a difference assisting in the OR. So it's really rewarding at the end of the day.
For sure.
Yeah, definitely. That was kind of the feedback I was getting. That one day I filled in. Heaven forbid this guy take a day off because his wife's having a baby. Yeah. But I got to fill in for Morgan one day, and that was kind of the feedback is it makes a difference. It's nice to be needed and to provide a service. So
absolutely.
One thing I always like to ask in orthopedics, I feel like you got to have something good here is what's trendy? What are the new things that people are coming in asking about? What's the new direction in orthopedic medicine?
The trendy things, at least that we're dealing with right now, is one is press fit versus cementing implants, right? So when you think about how something's going to connect to the body and replace, right? When you think about a knee replacement, you're putting in metal implants to replace the top of the bottom bone and the bottom of the top bone, right? So that joint, so instead of it being bone on bone, you're bone on metal on plastic on metal on bone. So that grinding doesn't cause you pain anymore. One of the ways that we're seeing it evolve a little bit is the ability to press fit more than you anticipated, meaning that you can take the cement out of the equation, right? And that the implants can fit so well into the bone that nothing's required in between the two. Now, if it's poor bone quality, you've got to cement it, right? You've got to make sure that that cement holds onto the bone and it holds onto the porous edges of the implant. But if it's good bone quality and that implant and that cut's been made as precise as it needs to be, the implant can fit perfectly. Right? And we're seeing that those press fit implants, they're lasting a long time.
That's awesome.
Right? We're seeing that, studies are still going, but implants are looking like they're going 20, 25, 30 years.
Are there differences in outcomes as far as patient satisfaction scores and things like that?
So that's where all the studies are going right now. And just from a few that Dr. Pitts was showing me this morning, not really like...
Pretty comparable.
Yeah. Like
non-inferior
really well. Yeah.
Yeah.
And
it's material. So
you could ask 10 different surgeons and you'd get 10 different responses just because like
people have their opinions on things
from the studies that they've seen, right? And how they were trained. But from what we're seeing, like patients are doing great with both.
I think we've always said less is more, right? Like you don't need
for sure. Like the more bone you can leave in there, the better.
Yes.
Right?
Yeah.
And so the less invasive we can be. And
I love that.
Yeah.
I love that. Well, good. That's exciting. I think one of the things I'm always interested in hearing is any funny, unique, inspiring story in your world of orthopedics that you could share with us, or even just in the medical field.
Story time.
We actually did a surgery on an orthopedic surgeon 4 weeks ago, and he stayed awake for the case.
Oh my goodness.
And so he had asked Dr. Pitts. It was a total knee replacement. Okay. And he had asked Dr. Pitts, he's done plenty of them himself.
Goodness.
He had transitioned out of actually practicing and into like a not like a liaison, but kind of like a consultant for some of these implant companies. And so he had asked around, which this is kind of cool. Like he had asked around where he should go, and from the people that he knew, Dr. Pitts was the one that was suggested. like pretty unanimously. And so he came to Dr. Pitts, asked him about what he would do, loved what he heard. We did the surgery. Like right before the surgery, he's like, also, I'd like to stay awake.
Oh, man.
Oh, my gosh.
I'm like,
no thanks.
yeah, I'm like, I don't think that's going to happen. Like, we get into a groove, right? We're talking, there's music going, like, not anything disrespectful to the patient, but like, it would just be another stress if the patient's awake.
100%.
But Dr. Pitts was unaffected. He's like, yeah, for sure. That'd be cool. I'm happy to have him awake for it. So we get to spinal. He's awake for the case. Obviously can't feel anything. But as we're doing the case, quietest case ever, by the way. I don't say a single word. We have no, like, I'm like kind of just like
the atmosphere
nodding my head at people to like grab things. I don't want to talk out loud just because he's talking to Dr. Pitts as the case is going. Dr. Pitts gets to where the implants are getting fitted and he's made the cuts, and he turns the screen around so the patient can see. He's like, what do you like what you see there? He's like, this is the varus valgus deformity. This is what we've corrected. This is the flexion extension.
Amazing.
He's like, yeah, I love it. He's like, all right.
Hammer it in.
Turns back around. We hammer it in. Close them up.
I can't even imagine.
Oh, I was not making a single noise during that.
That's awesome. To me, that is a testament to the confidence and the skill level and the quality of a surgeon. That wouldn't phase him to say that is completely fine. Doesn't change what I do.
Yeah, for sure.
I had an interesting experience with Dr. Edwards, our neurosurgeon, has done surgery on my dad.
Incredible.
He's great. He did surgery on my dad, and it just happened to line up that I was going to be there on surgery day for my dad's surgery.
Yeah.
So I asked him, and I said, hey, the scheduling's lining up that I'm going to be there during my dad's surgery. Is that a problem with you? Are you okay with that? And he acted like that was a funny question. Like, why would you ask? He's like, of course that's fine. He's like, I would be happy to have you there. And he says, every patient is somebody's dad. Every patient is somebody's loved one. It doesn't change how we interact with people or what we do. Yeah. We should treat everybody that way, which, again, I think it's a testament to a great surgeon.
Oh, for sure. And that makes you, like, if you hear this, you think, oh, he keeps that in mind. Like, I would have no question sending my mom or my dad to a surgeon that thinks like that.
Exactly.
Right? Because not all surgeons are the same.
It's true.
Right? Not all doctors or mid-levels are the same. Right? So someone that thinks like that, it's awesome to see.
It is. It's awesome. Well, we better wrap it up. Morgan, thanks for coming. This has been awesome.
Yeah.
Tyler, what'd you learn?
Man, I learned a lot today. I think, obviously I know you, Morgan, but just to get to know you on a deeper level, even just to hear some of your stories, what you know about orthopedics, I think is great. There's a lot that's coming out as far as innovative ways of doing things. Obviously, I know the robot's been out for a while, but it sounds like Dr. Pitts is fully bought in, and I think it is making a difference because it seems like the patient population in this community is super happy. I do appreciate the knowledge as far as the work-life balance. I think that's always something we want to know about as advanced practitioners in the different specialties. I think orthopedics can be time demanding, but it sounds like you're finding the right balance. So I think that instills some hope for those future orthopedic inspirees or people that are inspired to go into orthopedics, that they can find a niche that kind of works for them and find that good collaborative situation. So I appreciate you coming today, Morgan. Appreciate the time.
Yeah, happy to be here. Love it.
Yeah. So how would people find you, Morgan? If somebody wanted to interact with you, ask you a question, get to know you, how would somebody find you?
I mean, come to clinic. I've got no presence online.
We talked about this earlier.
Yeah.
None of us have a social media yet, which we maybe should not admit.
Shouldn't divulge that information.
We're probably need to make one.
Yeah.
Come see him in the office, guys. He's fantastic. He's great. As far as our company as a whole, Summit, you can find us on Instagram. Not me personally, but our group. Come interact with us. Summit Brain, Spine, and Orthopedics. Our YouTube channel, Summit Medical Institute. And as always, come hang out with us in person Tuesday mornings, 7 a.m., Holy Cross Mountain Point Hospital for our interdisciplinary case discussions. Special shout out to our production team, Dallin and Amelia. Can't see them or hear them, but we all know they're the true heroes here. We appreciate everything that they do. And as always, we'd love to hear from the listeners. Give us some feedback. Let us know what you like to hear. Who should we get out on the show? What should we talk about?
I think we've got some interesting people coming up, though.
We've got some great ones coming up. We've had some great interactions. I think you'll find this entertaining.
Yeah.
So stick with us. This has been another episode of the Many Minds podcast, where we encourage collaborative community healthcare using many minds for better outcomes. I'm Alex Davis.
I'm Tyler Murray.
He's Tyler Murray. Thanks for listening with us. We'll see you next time.
Until next time.